Welcome to Youth Dialogue, a podcast where we deep dive into digital health with experts from the field. Youth, or Youth Ownership of Digital Health, is a community of young digital health professionals from across the world. You can click on the link in the description to become a member. Today's episode is part of a very special series celebrating the Digital Health Week, a global week of action to promote digital health as a means of accelerating universal health coverage. We are dedicating each day of the week to a specific theme on digital health. And today's theme is creating an enabling environment for effective and equitable digital health transformation. I am Pallavi Jain, Program Lead in the Digital Health Vertical at Path India and also Secretariat Lead for Youth. I will be your host for the episode, and I'm proud to be a part of the series co hosted by Youth, Transform Health, and young experts in tech for health. Today we have with us Sean Blaschke, Senior Health Specialist and Unit Chief with UNICEF Headquarters Team. Sean is a development specialist with experience in advising government and development partners on health system strengthening, health information systems, and national digital health programs. His focus has been on designing and applying innovative solutions in African countries, the Great Lakes region, and the United States. Sean, welcome to Youth Dialogue. My introduction doesn't do justice to the extensive body of experience you have and the tremendous work that you've done. So we'd love to hear a bit more from you, and for you to tell us about your work.
Fabulous. It's an absolute pleasure joining today. A really important conversation to have, and looking forward to diving into what I hope will be some challenging and complex issues.
Wonderful. So Sean, wanted to just dive in, and there has been a lot of conversation about the need for achieving universal health coverage by 2030, and equitable healthcare. Can you tell us that what does universal healthcare actually mean? And in your opinion, what would a world with access to equitable healthcare look like?
Great question. So universal health coverage really means ensuring that all individuals, communities, regardless of your status, receive health services that they need without suffering financial hardship. And so I'd like to look at it through a couple of different lenses. One is around health equity, looking to reduce disparities by ensuring that everyone has access to quality health services. For UNICEF, our focus it looks at vulnerable populations, including children, women, marginalized communities. One of the things actually that's coming out more recently in terms of health equity is around connectivity, being increasingly recognized as a super determinant of health outcomes. We also like to look at universal health coverage in terms of economic benefits. We know that investing in health systems strengthens economies. Healthy populations are more productive. They reduce the financial burden of the broader health system by preventing people from falling into poverty due to medical expenses. And finally, given UNICEF's work across a range of different contexts, UHC for us also requires looking at the resilience of health systems, promoting robust health systems capable of responding to health emergencies, whether they are pandemics, and ensuring that essential services are maintained even during crises.
Mhm. Sean, you mentioned, several parameters or variables which can actually, impact how countries are able to achieve UHC, whether it's infrastructure, whether it's, investment, whether it's policies. So if we compare developing countries and developed countries, of course, there is a huge disparity between, where different countries are. So, can we say that UHC can actually be a reality for all countries, or will it remain a utopian concept for many developing countries?
So what are the tools that we use to gauge the digital readiness of a country to be able to design, deploy equitable digital health interventions? Is a platform called the Global Digital Health Monitor, and this helps us assess whether a country's both strengths and or gaps lie across the seven different WHO digital health building blocks. So looking at it from a policy, legislation, standards, interoperability, health
Hmm.
workforce, financing, infrastructure lens. And what we see is often certain disparities that impact countries more commonly. And health workforce capacity tends to be one that's quite significant. But another one in terms of architecture, standards, and interoperability. Interestingly, we see many countries in the global south
Hmm.
with policies, strategies, roadmaps that are progressive, that are again architecture and standards driven. And so I don't think it's a north south upper income LMIC paradigm where global north is ahead in all different digital health system areas. We see plenty of areas now with emerging countries, emerging economies that are planning, deploying investments in a far more strategic way. So what we're seeing is that different typologies of countries tend to have relatively common needs or gaps. But I definitely wouldn't pose this as a can the global south catch up to the global north? Because
Right.
again, what we are now seeing is everything from personal health records
Hmm.
to standards and architecture. Many countries in LMICs really starting to provide global thought leadership and building the systems that they're going to be able to leverage for years to come.
Right. That's actually very valuable insight to know that many LMICs are moving in a far more strategic manner than we think they are. Can you give us an example? You've worked so extensively with so many African countries. If you can give us an example of any one country and how they are perhaps strategizing their digital health advancement and the long way that they perhaps have come now.
Right. So one of my favorite examples was or is Rwanda and how
Mhm.
they were able to relatively quickly during the COVID-19 crisis put in place systems to monitor vaccination coverage. And the story doesn't start with COVID-19. It actually starts
Mhm.
about a decade before, where Rwanda invested heavily in governance. The Ministry of ICT developed a overall vision, a strategy, a set of policies focused on a multi-sectoral, and now what we're seeing is a digital public infrastructure or e-government led set of investments. And they put in place in each of the different ministries, education, health, senior architects, business analysts, so that there was again an ability to contribute and invest in a common vision. And what a few things that Rwanda had done that I think really allowed them to move quickly during COVID-19. One was investing in CRVS and digital identity, the ability to longitudinally track populations, to leverage geospatial tools to identify communities that may be missed out. Again, these foundational data sets, the multi-sectoral governance does not happen overnight. And what Rwanda did was they looked at everything from policy reform, bringing civil registration services within the health sector. They created a single stop. At health centers, birth registration integrated into community-based insurance schemes program, and then linked vaccination to this. And what this resulted in Rwanda during COVID was them being able to quickly pivot and not only deliver some of the highest vaccination rates on COVID vaccination rates in the continent, but the ability to monitor and
Mhm.
report on this. And so, as countries look to use cases best, exemplar countries. I think it's really important to note that whether it's India with their investments in DPI to Rwanda,
Right.
these required really strong investment in multi-sectoral governance, strong leadership from offices of the president, the prime ministers downwards, and years worth of strengthening of underlying systems. And this has really allowed what we've seen is several countries to accelerate efforts to equitably design, deploy digital health interventions.
Sean, it's very good to know that even with whether it's the global south or other LMICs, there is such strong governance and infrastructure and investments that are happening, and even strong leadership which believes in technology driving the future. Having said that, when we talk about digital health, it still has not reached the last mile. Whether it is because of issues of exclusion or inequity or a lack of access to technology. How can we actually take digital health to the last mile?
So a couple of the barriers that I think have constrained us, one is infrastructure. Uh, Both connectivity, power, and affordable devices. We know that the most privileged facilities tend to have the best resources, the best infrastructure. The most marginalized, the most remote, often the most rural, tend to be left behind. And until we expand connectivity, until we look at how we're going to finance this, not individually partner by partner or project by project, but taking into consideration recurrent costs, replacement costs, affordability of devices, digital literacy of last mile health workers, we will not expand or meet the promise of UHC through digital health. So infrastructure development, absolutely key. Inclusive design, human centered, looking at the different contexts
Right.
within countries, county by county, district by district, considering their unique needs, their literacy, their cultural contexts, and engaging communities in the design process, ensuring
Mhm.
that they're relevant to them. That needs to be done. We know that capacity building, both upstream at national level, again, all the way down to your community health workers, is an area that most countries are relatively weak in. Robust data governance, DPI, ensuring that digital identity, as which is increasingly being used to access health services, doesn't provide new barriers. If marginalized communities are not being provided with birth registration services, if that is not universal, yet your national ID is required to register for appointments, vaccination services, telemedicine. Again, we are creating barriers to universal health coverage. So I think it's going to be really key to look at this these investments, not as investments from development partners or projectized initiatives, but really understanding those underlying systems, recognizing that digital transformation is not about individual solutions, but it's about
Yeah.
the systems, the architecture, the data models that need to be considered, designed, very strategically from the start. So quite a bit that I think needs to be done. I think on one
Yeah.
side we know that digital health provides an opportunity for more equitable health services. We know that we can bridge the divide through telemedicine platforms where the health workforce is limited, or where specialists are only in capital or provincial cities. But we need to be very deliberate to make sure that those barriers to accessibility, to equity, are identified and addressed.
Wow, Sean, there's so many things that you've mentioned, whether it is, keeping people at the center of the solutions, not seeing things from project to project, taking a more holistic picture into account. I'm just bursting with questions right now. But I think one of the biggest insights for me from what you just said right now was how important it is to actually, take people together, keep people at the center of all solutions, and actually build ground up approaches, and digital health is maybe just a means to achieving UHC. Digital health does not mean that it is that a country has achieved UHC. It's rather just a means. So, Sean, since you mentioned that countries should not be planning strategies based on project to project, we need to look at a more holistic picture. Do you think international collaborations and aligned financing between governments can actually help transform, health systems to achieve UHC? And are there any innovative financing models that, can perhaps be mainstreamed or replicated by governments?
We know that digital health again offers the promise to improve cost effectiveness, efficiency gains. There was a recent report published at UNGA by the UN Entity Task Force that was loaded with evidence that demonstrated, for example, there was a 17 to 1 return on investment for telehealth platforms.
Uh-huh.
Which is amazing. If you're an investor and you saw 17 to 1 return on your initial investment, I would bet on that. But this these returns on investment, these effectiveness efficiency gains, again don't happen naturally. And they require governments to, for example, know the total cost, not of an intervention, but the entire system, again, from infrastructure to human resources. And this is something that we've seen, whether it's donors, development partners, governments struggle with. We tend to
Mhm.
plan to cost based on disease vertical. We look at it in terms of, this is what it costs to do immunization or nutrition or maternal health.
Right.
But when we plan like this, we fail to leverage those economies of scale, those shared investments across different interventions. And so this needs to change. I think we've also been burdened by legacy digital health programs that have been boutique, that have been partner donor driven, and that have fallen outside of how governments plan, cost, and finance health programs, not digital health programs, but health
Right.
programs. And so
Right.
um, unpacking and reframing digital health rather as digital in health, that all health programs
Mhm.
should assume they have digital components to
Yeah.
it. This should be fully integrated, fully costed
Mhm.
in government plans and government budgets. And one of the things that UNICEF and partners are now really banging the drum on are around supporting a single government plan, a single government budget, and a single government
Mhm.
M&E framework. And so we are challenging ourselves not to come with our own plans and budgets,
Yeah.
but work backwards. And we're doing this with a partnership with Africa CDC at the moment with community
Okay.
health programs, where we've
Mhm.
supported them to cost what will it require to move on the continent from 500,000 to 2 million community health workers, and
Right.
looking at it from a needs based, not a resource based
Yeah.
lens. And,
Yeah.
noting that UNICEF, we will be a key contributor, but we're not going to be the only player. And
Mhm.
we need to make sure that this government plan, this government budget is inclusive to other partners, that they see a role for their priorities, their programs to fit into it. But that at the end of the day, this is something that's managed, owned by government. So I think
Right.
going back to your question around financing and
Mhm.
ensuring first that again these are integrated into national plans and budgets, and they are not side streamed as health and digital. We're
Yeah.
seeing a lot of opportunities with blended financing, combining public,
Mhm.
private, philanthropic resources, bringing in new donors, new partners to the table, noting that blended financing often reduces risks for private sector investors,
Mhm.
leveraging larger amounts of capital. We've seen some outsourcing. So, for example, biomedical equipment as a service, ICT infrastructure as a service, where government can focus more on their strategic planning, the areas that they are investing capacity, while leveraging the private sector, which in many cases is more cost effective to deploy downstream services. We've seen opportunities with impact investing, generating
Mhm.
social financial returns that can support digital health investments. We've also seen many countries now achieving success with public-private partnerships,
Uh-huh.
bringing in, again, private sector expertise, technology, when government is in the lead. I think that the big risk here is that we get caught up on shiny objects, digital tools that are seen as a panacea or a silver bullet, rather than focusing the other side. This is in most countries, governments have been investing for quite some time, a decade or longer, and noting that we need to work outwards. Identifying, acknowledging, and strengthening what exists, and using the private sector and their expertise, their systems to not replace what government has, but to augment, enhance, and strengthen it.
Right. I can see you constantly, putting the several hats, that you have, whether that's of a health systems expert, comms expert, strategist. Um, and the very pertinent things that you mentioned, whether it's augmenting what is already existing, looking at things from a need based perspective. I wanted to ask you that, through, so many projects that you worked on, so many countries that you worked in, through your experience, can you tell us that, what are some of the principles which innovators should keep in mind when they are trying to devise a solution
Mhm.
for any health or digital health related issue? Some of the key principles that they should be keeping in mind when they're trying to build a strategy to be actually implemented on the ground.
Mhm. So one area that I haven't touched on yet, but I think is really important, is a focus on patient-centric,
Mhm.
provider-centric systems.
Right.
We've already touched, I think, on the importance of government ownership, of partners collaborating, aligning rather than
Mhm.
competing, of strengthening systems. But one of the things that again, as UNICEF, we've been working with partners to try to shift the discussion. A lot of the early investments in digital health were from a health informatics lens. They were looking at digital health as ways to capture information to report to donors. How many people are being reached, how many commodities are being deployed, etc. But these early investments in digital health systems, or rather information or health informatics systems, often did not look at a patient holistically. They were designed around the need to report on immunization outcomes or nutrition
Yeah.
outcomes.
Yeah.
But we know that a child suffering from one deprivation, a zero dose child on immunization, is likely to suffer from multiple deprivations. And so
Mhm.
we need that 360-degree view of the child.
Yes.
But at the same time, while generating data is critically important for decision making, for policies
Yeah.
at national level, services
Yeah.
are deployed by health workers. Decisions are made by fathers, by mothers, by
Mhm.
young people, and the systems that we are investing in need to, I believe, be first and foremost designed for their needs. And so this is a big shift in terms of, for
Mhm.
example, investments in electronic medical records. Should we be looking at centralizing data,
Yeah.
which, while again that provides far more insight to national governments, it's very burdensome. It's very costly. It puts data at higher risk. Um,
Yeah.
or maybe this is not a or, but an and or discussion. But looking at what do health providers need, and what do consumers need, to make sure that they're able to understand, to access, and receive the health services that are most important to them. So I see a very big movement at the moment. This week at the Africa Health Tech Summit in
Mhm.
Kigali. Smart Africa is going to be launching a digital health blueprint for the continent, and it's going to be very much centered in this patient-centered approach, focused on consent, focused on enabling portability of health records, and an acknowledgement that the data, the decision making around the data, the ownership of the data should sit with the individual, and government's role is to support, to facilitate, to enable, to provide services. But at the end of the day, we have to empower that those individuals, those health workers, as part of this.
Right. Sean, you mentioned that the ownership of the data should rest with the individuals, right? Um, Whether it's patients or any other consumers of any kind of technology, it's the data of the user which actually gets captured. So the ownership or the access to data rather is in the hands of whoever owns that technology as well. How can we try and build trust within the consumer that the data that they're giving access to is safe?
So I think part of this goes back to that social contract between
Mhm.
individuals and government. There needs to be trust that government can be, will be a custodian of data that works in the best interest of individuals, and that requires robust data governance, clear policies. That establish data privacy, security. There needs to be compliance mechanisms, regulatory frameworks, so that individuals know that the digital solutions that they're being asked to use are easily accessible, compliant with national policies, are transparent. And so this is going to be really key, is strengthening that social contract and trust and credibility with government and partners. I think far more emphasis needs to be placed on user consent and user control. We
Yeah.
talk quite a bit about informed consent. Uh, you
Mhm.
know, providing individuals with the opportunity to opt out of entire services or partial services. But the challenge at the moment is that when you opt out of, for example, a vaccination program that uses a national ID, there are not alternative services in many countries. And so
Right.
informed consent and the ability to opt out isn't viable if this is required to receive what are often life saving services.
Mhm.
I think a big component of this is going to require community engagement, participatory design, and
Yeah.
continuous feedback mechanisms. This should not be seen as a one-off.
Yeah.
Digital transformation does not have a end date. We too frequently do not build in user experience testing, that those participatory feedback mechanisms into the design, development, and deployment of platforms. So this needs to be changed, and establishing channels for users to again provide that feedback, whether it's help desks, grievance mechanisms, so that when the systems are not working, when people find there are bugs, they find that they're being excluded, that there are mechanisms for them to not only voice what their needs and concerns are, but that there's transparency on what government is doing with this information and how they're addressing these concerns as communities ideally are articulating them.
Right. Right. Um, You talked about data transformation, right? So on one spectrum, data transformation, since we talk about digital health, could mean, adoption of technology, or, how far has technology penetrated to the last mile, and, different kind of tech enabled solutions that, we might be able to come up with. The other part is the social and behavior change component of things, right? In my personal opinion, in order for anything to be for a solution to be sustainable, it has to truly be adopted by the community that we're trying to solve for. So how much importance is actually given to social and behavior change communication? You mentioned about human centered design, people participation. In reality, how much emphasis is actually paid to these components?
hmm I think we can come at this from a couple of different lenses. I think one is around the acceptability of the interventions.
Yeah.
I think one of the most painful things to watch coming out of the COVID-19 pandemic was a mistrust in government, a mistrust in health services, a mistrust in
Mhm.
vaccines, and a growing voice from sources that have their own incentives that aren't necessarily aligned with public health outcomes. And
Right.
so rebuilding this trust between the health sector and communities is very, very important. I think one of the things that UNICEF invests quite a bit in is social listening,
Mhm.
in locally tailored solutions, understanding that people are not going to necessarily listen to partners like UNICEF or governments. They're going to listen to local influencers. They're going to listen to faith-based leaders. They're going to listen to their neighbors. They're going to be getting their information from social media,
Yeah.
and this is where we need to have these conversations. And so
Mhm.
again, increasingly, what we are doing is not coming in necessarily saying that we have all the right answers, because we don't, and we need to recognize that what again works at national level doesn't always work across all contexts at local levels. So focusing on localized solutions, localized conversations, feedback
Mhm.
loops between individuals within the communities. The other side, I think, of the equation is as we're designing, working with governments to develop and design the solutions. Again, understanding that a one-size-fits-all approach is unlikely to work in many contexts. An
Correct.
interesting example of this is coming from Kenya with their recently published Digital Health Act and
Mhm.
the digital health highway that they've been investing in. And what excites me is that the government of Kenya has recognized through their devolved structures that counties need to be empowered with the ability to identify what digital solutions are going to be most effective. But at the same time, the national government is putting scaffolding around what decisions, what solutions, what interventions, meet these national standards. And so the government of Kenya has been investing heavily and actually has just published an RFP to develop a health information mediator based on a reference health information exchange architecture. Government of Kenya has been very strong proponents of HL7 Fire to promote common data models. And so, while the government of Kenya has been investing in national reference applications, making these available to counties, at the same time, they are not dictating to counties what specific tools they provide as long as they meet these architecture standards, cybersecurity, data protection
Right.
best practices. And I think this kind of approach, provides the best of both worlds, where the government is recognizing and investing in a systems thinking approach, but at the same time, not dictating solutions that need to be tailored. Again, often county by county.
Right. There's so many concepts that are just coming to my mind, whether it's the positive deviance theory, whether it's the socio-ecological model, ECD already mentioned. Can you think of any one example or any one project that you may have worked in which perhaps is the closest to a perfect combination of the so many things that you mentioned?
Perfect combination. That's a challenge. Um,
As close as we can get, maybe.
Mhm. So again, I think you could point to a number of countries that are starting to plan based on what a collective or an ecosystem approach of digital health investments can deliver on. And so rather than picking one country, because again, I don't think we have any single country that has put together all the pieces, but we do have several countries that are putting together both that roadmap and interventions in a way that the puzzle pieces are starting to connect. Again, a good
Mm-hmm.
example of this is Sierra Leone, who have recently launched their digital health strategy. One of the
Mm-hmm.
interesting things that's happening in Sierra Leone that I think has been very strategic is that they're not looking at primary healthcare and community healthcare separately.
Uh-huh.
When we've seen countries digitalize interventions at primary healthcare and community health level, when we plan these separately, what we often find is that everything from management tracking of commodities to referrals, even with the best blueprints in place, when we're not actively developing and designing these in an integrated fashion, the devil is often in the details, and we find that the best laid plans architecturally cannot be necessarily implemented in a practical way. And so I think as we see countries like Sierra Leone start to plan, design, and deploy solutions that are connected, I think we're seeing ability to better enable the patient on their journey as they are going from public to private sector institution, going from community to primary to secondary or tertiary services in a way
Right.
that is more frictionless.
Hmm.
I think the other side of the coin, and in fact, one of my greatest learnings in this space was on a project in Uganda, probably 12 or 13 years ago,
Uh-huh.
focused on enabling the monitoring of community health interventions. And at the time, when we spoke to community health workers, what came up again and again from community health workers were when the supply chain system breaks down, when we do
Hmm.
not have adequate provisions of RDTs and ACTs for malaria, for example,
Hmm.
communities lose trust in us. They think that we are saving or hiding or stealing these diagnostic and curative medicines, but in reality, they've been stocked out. And so this initiative in Uganda about 12 years ago, we designed it, we anchored it around, well, if we can enable the health, community health workers, if we can capture what their stock levels are, we can do a better job in modeling, predicting stockouts. We can move commodities to where they are most needed.
Uh-huh.
Voila, that's the silver bullet. Um,
Hmm.
6 months into the program, we saw a change in reporting rates. Right off the bat, we were getting up to, if I remember correctly, about 90% of weekly submissions from community health workers in Uganda, which surpassed our target quite substantially. And at the time, we saw very few stockouts of ACT RDTs in the country. But over a course of about a 6 month period, we saw stockouts start to increase. And at the time, I got very excited. I went to my malaria counterparts, our supply counterparts. I said, "Yes, we have the data. Let's start acting on it." And what I learned was that based on how donors were financing, were procuring commodities for community health workers, based on the push pull system and a lack of responsiveness at the time to
Hmm.
community needs, the supply chain systems in Uganda were not able to respond quickly enough to moving supplies where they were most needed. And what we saw was a very clear link between reporting rates and stockouts. And as community health workers increasingly got frustrated, they stopped reporting. They started to message, we've given you the data. You've had the data for 1 month, 2 months, 3 months. What are you doing with the data? We saw a risk of growing mistrust in the
Hmm.
digitalization of these systems. And eventually we pulled the plug
Hmm.
on the system because we were very concerned that the inability of the systems that we were designing or strengthening to immediately address the needs of community health workers would likely hurt the ability to roll out future interventions. And for me, the personal learning on this was I didn't understand enough of what the supply chain strength, supply chain systems in the country looked at the time. I didn't know,
Mhm.
what the strengths, what the weaknesses, what the limitations were. I assumed that the data itself would be able to drive action, drive change.
Right.
And this was a really hard learning, having to go to the
Yeah.
donor and say, look, we've decided to shut down this initiative. We need to
Mhm.
step back. We need to work with the Minister of Health, with the national medical stores, with
Mhm.
the health monitoring unit, to look at how do we better optimize the supply chain? How do we make it more
Yeah.
uh, sensitive to last mile needs before we bring
Mhm.
in digital solutions? Because the digital solutions that we deployed didn't fix the problems. What they did
Yeah.
was they took a system that had gaps, and they made the gaps worse. And
Yeah.
so, I think we often hear that, if you digitize a broken system, you get a digital broken system. And I think for me, that
Mhm.
very, very important reflection in terms of really understanding all the non-digital components
Right.
of a health
Right.
system, and working concurrently or first with governments to optimize them, and then making sure that the digital solutions enable strong foundational systems, rather than the other way around.
Mhm. Wow, that was. I can see there's so much of learning and unlearning that happened, during the course of this project. Sean, since our episode is mostly focused on the youth who are working in the digital health space, I wanted to understand that is the buy-in or is the voice of the youth now actually being considered when we're trying to create any kind of solutions? Are we giving enough importance to the youth as a stakeholder when it comes to talking about digital health? Because we're talking about driving technology in the healthcare sector, and technology is something which comes very intuitively to the youth. They are the future. So according to you, what's their stake in creating these advanced systems?
I'm going to go with both a glass half full and half empty. I think there's a clear recognition that patient centric solutions require listening. They require us to set our expectations at the door. They require us to hand over leadership of these to communities that are receiving these services, whether they are 15 or 25 or 55 years old. But at the same time, we can do a lot more. I think a lot of the conversations are still too tokenistic. They are one off. They don't continuously recheck, revalidate, re-verify whether these investments, whether these solutions are really being designed, implemented in the um, best cases for young people. But at the same time, I think there's been a few, and will be a few, very big changes. I think what we're seeing is a lot of tools that are coming out that are developed directly for consumers, that don't necessarily have to go through governments or organizations like UNICEF. And
Yeah.
this democratization of information, of technology, of the ability to understand what your rights are, and how to access health services. They're allowing young people to hold us more accountable, to enable them to understand and demand their rights. And the more
Yeah.
this happens, the more that solutions are driven by communities, the better I think we're all going to be. I think we're also seeing this in terms of more enterprise solutions, with
Hmm.
every Google Open Health Stack,
Yeah.
to a lot of the Fire-based tooling that's coming out. If you looked at the digital health space 5 years ago, it
Yeah.
was driven by companies in the global north. If you want to develop a digital health enterprise solution 5, 10 years ago, you better be willing to pay 10 million, 20 million, 50 million, $100 million, because these systems were very hard, very expensive to deploy, and it essentially shut the door on many countries or many companies in the global south. Where governments still worked with those companies in the global south, what we often found was that there was an underestimate, misunderstanding of what the total cost was,
Right.
and solutions that often had to cut back on architecture, standards compliant data models, interoperability,
Mhm.
because they were in a resource limited environment, and the technical debt that was created, the systems that are now legacy that need to be thrown out and reinvested, has been quite significant. This has changed over the last few years, with again the open health stack, with the fire tooling. We now see companies in more resource constrained environments being able to develop really good solutions that are architecturally and standards compliant, without having to necessarily have very expensive expertise in their
Mhm.
teams. That scaffolding, those foundations have been provided, and I think this is allowing more localized solutions, more localized support, more contextually driven initiatives being able to be developed and driven by companies in the global south, without compromising on security, without compromising on architecture, without compromising on standards. So I would say, watch the space. I think young people are going to be able to be more meaningfully involved in
Yeah.
not only driving the types of solutions, but being able to contribute directly to the software, to the technologies that they are using.
I think this leaves us with a very hopeful note that just the way there has been so much of transformation in the space in the last 5 to 10 years, now with more and more DPIs and DPGs coming up, this space is becoming more and more decentralized and more democratization happening in the space. So I think there's definitely, as you said, much to watch out in the space. Sean, I'm now going to move to our last segment, which is a rapid dialogue. So I'm going to ask you a quick bunch of questions, all fun ones, and you can, give me maybe one-word responses or one-liner responses. Yep.
Yep, let's do it.
Great. Let's do this. Perfect. So my first question is, what's the one thing that motivates you to wake up in the morning?
So I would say my family. I have a child with special needs, so issues around equity inclusion are personal, and everything I do is through that lens, and I understand, with having a child that can be marginalized, the challenges that others that are even less fortunate face, and for me that's what drives me every day.
Great. Thank you so much for sharing that personal story with us. Yeah. Are you a tech geek or a book nerd?
I'm a little bit of both. I don't think I can say one or the other, but more recently, probably a bit more of a tech geek.
Okay. What's the one app that you can't function without?
But actually, both me and my wife have been heavy users of Gen AI tools. I find whether it's Copilot or ChatGPT,
Hmm.
it can be massive time saving devices. I think it's important to use them not as a replacement, but as a way to augment your work.
Right.
But yeah, these Gen AI tools have already allowed me to avoid a lot of the more routine or mundane aspects of my work, and focus on the more creative sides.
Do you have any role model? And if yes, then who would that be?
You know, my so my role model is actually the person who brought me into to UNICEF, Sharad Sapra, who unfortunately passed away a few years ago. He was so proud of the fact that UNICEF hired him 6 times but fired him 5 times, and he was never willing to accept the status quo. When UNICEF was doing something that he felt was not in the best interest of the child, he did what was right. Sometimes that meant pushing, bending, or going against policy. But what Sharad always was able to demonstrate was that overall mission, the overall goal, was more important than individuals or institutions, and really reshape the way that not only UNICEF but the people that he recruited, that he hired, now sit everywhere from USA to World Bank, and have really shaped the thinking in this space, in ways that have, I think, allowed people to feel comfortable speaking out and working to not accept the status quo, but to
Mhm.
shape, influence, and change it when needed.
Right. What's your life's motto?
It's a good question. I'm going to borrow a quote from Winston Churchill here, because there's a far smarter, wiser people than me. So Winston Churchill once said, "Success is not final, failure is not fatal. It's the courage to
Mm,
continue that counts." And I think, not resting on your laurels, always questioning, how can I do more, how can I do better, but at the same time, looking at failure, at mistakes, as an opportunity to grow. A failure is not a failure unless you don't learn anything about it, and do not share your failures with others. And so, being able to both learn from your success and failures and continuously self improve, yeah, I think a motto that I would live by.
wonderful. What's the best piece of advice that you have ever received?
So I'm going to go back to Sharad Sapra again, and years ago, back when I was interning for him, he said, "Look, don't get caught up on titles, on seniority of positions, on the all the things that come with specific jobs. Pick the team, and pick the work,
Mhm.
that you're passionate about. If it's a junior position, if it's
Mhm.
with a organization that doesn't have the same stature globally, that's fine. You're more likely to succeed with the right mission, the right team,
Mhm.
and benefit personally, benefit professionally.
Yeah.
And so I've long, every stage of my life, pick the next career steps based on, do they have strong leadership in the
Mm,
team? Do they have a strong vision? And is this is a team that I feel like I will be constructively participating and contributing to?
right. Sean, coming to my absolute last question. We have so many young people listening into this podcast. What's the one advice that you would like to give out to them?
Let me go back to the interconnectedness
Uh-huh.
of this field, and whether this is at an individual level, organization level, or a systems level. We've moved from digitization to digitalization to digital transformation, and one of the messages that keeps, I think, or is increasingly emerging, is that digital transformation is not about individual solutions; it's about the systems. And so, if we want individual solutions to succeed, we need that digital health, that health systems highway, to be paved and clearly marked and well designed, to ensure that these individual solutions succeed. So, back to interconnectedness, young people, look at what is that ecosystem, that you are already or want to work in. Note
Mhm.
that as individuals you can contribute massively, but not on your own. Organizations. I mean, I think one of the things that I'm most excited about globally, has been the global initiative on digital health that WHO
Mhm.
launched during the India G20 presidency.
Right.
And specific, the clear articulation that WHO alone, UNICEF alone, member states alone, the
Mhm.
smartest entrepreneur on their own, the most engaged youth on their own, will be limited in terms of how successful they will be, if they are not part of that larger system. And so,
Mhm.
whether it's improve coordination and alignment of development partners, or whether it's an understanding that at individual solution level, we are far better off looking at how we can not only provide what makes sense in the more immediate area we're working on, but how can we enable, empower other solutions. This is not a zero sum game. We
Mhm.
succeed when others around us succeed. So
Yeah.
I think my message to young people is, get excited, get engaged, look at, understand that larger system, and figure out where you are passionate and where you can contribute to that interconnectedness of what is now emerging as a digital and health sector.
Sean, thank you so much for such an enlightening conversation. I'm definitely feeling much more excited for what the future holds and would like to, conclude our conversation on this hopeful note. So, once again, thank you so much for doing this for us.
Absolutely, it's been great chatting today.
Thank you. And to all our listeners, stay tuned. Don't forget to share, like, and subscribe the Youth Dialogue channel. Thank you so much.
Thanks.
Thank you.